Bismillah ar-Rahman ar-Rahim. This is Muhammad Abdul Ghani, and this is our first part of the review of the course on ABC of biomedical research for cardiologists. The topics we are going to cover today are types of clinical studies, types of publications, structure of a scientific manuscript, how to find a scientific paper, and how to critically read a scientific paper. Let's start with types of clinical studies. The typical question asked by any biomedical research is to explore the relationship between an exposure and an outcome of interest. When we tackle this question, there is a number of studies and study designs that we can adopt in order to reach the answer. The most robust is the so-called experimental or interventional study, and this can be randomized or non-randomized. If the investigators doesn't assign exposure, then the study is an observational one. An observational study can be single-arm or descriptive and can be comparative or analytical. A comparative study can either be cohort, moving forward from the time point of exposure until the outcome occurs. The opposite is either a case control or a retrospective cohort study starting to trace the patients from the time point of the occurrence of the outcome backwards to the exposure. The third form is a snapshot or cross-sectional study. Most of these studies are subject to different sources of bias. The most important are selection bias, which is a systematic difference in baseline characteristics of the comparative groups. Attrition bias, detection bias, and reporting bias are other examples. Another source of inaccurate conclusion of a relationship between an exposure and outcome is the phenomenon of confounding. A confounder is a third factor other than the exposure and the outcome that can impact both and may lead to false conclusions regarding the relationship between the exposure and the outcome. Each of the study designs that we mentioned earlier are prone to different biases and to the effect of confounding with different degrees. For example, among observational studies, cohort studies are less prone to these sources of error. Accordingly, there is a hierarchy of evidence pyramid that sorts different designs of studies according to the quality of evidence derived from them. And based on the risk of bias, the order of these studies puts the cohort studies at the top of observational studies, while randomized controlled trials comes at the very top of the entire pyramid. Let's quickly review the types of publications. We can broadly separate and classify journal articles into two major groups: primary literature and secondary literature. The most important among the primary literature phenotypes is the original research or original investigation or clinical study. A smaller form involving one or few patients is the case report or case series. Sometimes the findings and the observations of the investigators doesn't need a full-length paper to be presented in. And in this case, the authors may opt to send a research letter or a research correspondence. Conference proceedings and abstracts is another form of publications, and the editorials can sometimes be classified as primary or secondary according to how you see it, because sometimes it covers many aspects of a review paper, including citations from previous publications, but also when you look at it from the perspective of that the author is putting his or her own input and her own fingerprint and her own opinion, then you can see it as a primary literature. Secondary literature include a group of publications, mainly review articles. And review articles can be classified into narrative review, systematic review, in which there is typically a specific questions being tackled, and there are predetermined criteria for paper selection, and there is some sort of evaluation of paper quality. Meta-analysis is a type of systematic review in which numeric results from each of the included studies are collectively combined and statistically processed to come out with a new mathematical result. Let's quickly review the structure of a scientific manuscript. Of course, the structure of the manuscript or of the paper depends on the type of the paper. And here we are covering the structure of original articles, systematic reviews, and meta-analysis because they typically follow the same design. An original article is typically composed of title page, abstract, introduction, methods, results, discussion, and bibliography. The introduction shall cover a lot of aspects, but basically tries to answer the question, why? Why did we conduct the study? Methods should actually present how did we conduct the study. The results should summarize what have we found. And the discussion should tackle the question of so what? What are the implications and the recommendations based on our findings? In more details, introduction shall tackle the importance of the problem and its magnitude, what we know in the field, what we don't know or the scientific gap, and what is the aim of our study and how it will address this gap. Methods should briefly describe the study design, the inclusion and the exclusion criteria of our patients, the methods that we are going to apply, and the data in terms of definition and how we manage and process these data statistically. Discussion should start with interpreting our findings in a more logical, more simplified, and more medical language, shall justify our findings and try to explain how they come and try to resolve any apparent discrepancies between our findings and the studies that came before us. Should, of course, focus on the implications and the recommendations based on the findings, and should transparently and honestly present the limitations and how to avoid them in the future studies. So, how to find a scientific paper? Lots of databases, but one of the most important is the midline database. And using PubMed, which is a search engine interface, you can search the midline database in addition to a little smaller databases. But basically, PubMed comprises more than 34 million citations for biomedical literature, basically from the midline database. So, searching PubMed is often straightforward, but sometimes you are hit by too many or too few citations. And in this case, you can use a couple of tips to handle this too many or too few citations. For example, the search term specificity. Let's take this example. Suppose we are searching for papers that addressed the role of transcatheter mitral valve repair for mitral regurgitation. If we use very broad terms such as mitral regurgitation and repair, it will include surgical and percutaneous, and will include edge-to-edge repair and other techniques. So it will give us so many hits. But if we try to be a little more specific by, for example, adding the term transcatheter, the number of citations will dramatically fall down. And if we take it to another level of specificity, adding the term edge to edge, then it will become even less. And specifying a certain technology such as MitraClip, the number will be much, much less. So in addition to term specificity, there is the Boolean operators. So these are and, or, and not. And the default that PubMed assumes we mean, even without saying so, is and. So if you put your terms without any Boolean operators in between, the PubMed will assume you mean and. But if you make it, for example, or, then the number of citations will be much bigger. A third tip is the use of filters. And there is a list of filters that you can apply to your search results. And for our example, if we apply the two filters of including only randomized controlled trials over the last year, then the number of citations will be only 2. The third tip is the use of the advanced search function. In advanced search, rather than applying your search terms to the default, which is to apply to the title and the abstract, you can apply it to very specific fields of your choice, such as you can search the authorship list, the title, the keywords, the abstract, or the entire manuscript. It's up to you. You can define whatever you want. So if we apply this to our example, and we apply the terms secondary mitral regurgitation and mitral clip only to the title, then the number of citations will be only 29, much less than what we started with. So our last question today is how to critically read a scientific paper. Assessing the quality of a published paper should start with judging the quality of the research question. The research question should be clear, should be original, should be relevant. It should be driven by genuine scientific inquiry and the desire to fill a gap in evidence, or rather in practice. On the other hand, research questions which nobody really cares about, often driven by the need to get anything published just to get a publication, is not that good. Sometimes some colleague is looking at routine clinical data trying to see any pattern to get a publication. This publication is often of very little value. So there is a number of items and facets and perspectives from which you can judge the quality of a paper, but the major pillars of this judgment are novelty, how new is our study and how interesting and novel our findings are, the significance for clinical relevance, whether our design and methodology are robust and appropriate, and whether the writing and presentation are attractive and fruitful. So if you Google it, you will find so many schemes to judge the quality of a paper, but this is just one of these schemes with this set of 7 questions which you can use to judge the quality of a given paper. Thank you very much for your attention.